Hi, I'm Dr. John Smith, Director of Education and Training at Social Model Recovery Systems. First, I want to thank all of you that are remaining on the front lines through this unprecedented crisis. Healthcare workers, first responders, and other essential workers as you serve the people that need your help the most. I wanted to talk to you today about taking care of yourselves during these stressful times. Besides taking care of your patients and your participants, many of you are taking care of children out of school. Many of you have spouses, partners, or other loved ones staying at home. There may be financial stressors as well. Almost all of us are anxious and worried about what is happening and what is to come. Let's focus for a moment on what we can do and what we can do to make things better and help us to cope with everything that is happening. So here are some things that you can do right away to take care of yourself that will make a significant difference. Probably one of the most important things that I can suggest to everyone is to take some time to decompress between work and home. If you're working from home, make sure that you set boundaries around work time and relaxation time and family time. Listen to your favorite music and avoid news and social media, especially things that are negative or things that are scary. Stay in contact with your friends and your family and your loved ones as much as possible through telephone, through teleconferencing, and through social media, limited of course. Stay in contact because that helps you avoid feeling isolated. Create a private space within your home or apartment, even if you have a small space. And if you're sharing that space with others, take turns using that space. Take turns taking private time away from one another. If necessary, respect each other's privacy. Take adult time outs from children, partners, roommates, etc. That way you'll have time to check in with yourself, to relax, to decompress. Maintain a schedule and a routine. This has been shown to help tell the mind and body that there's consistency, and when the body and the mind feel consistency, it's sort of a signal that everything's moving as it should be. Set a goal. Find something to look forward to. Many of us get stuck in worry, which is the equivalent of the mind getting stuck watching disaster movies, all the what ifs, all of the things that could happen. When that happens, that creates anxiety. Looking forward to something tells the mind there is something ahead, positive, and it will help ease your mind as you move forward. This may sound kind of funny, but take care of your ADLs. That's what we call activities of daily living. Eating, sleeping, yes, and even hygiene. It's important to take care of yourself in every way possible. Move, walk, exercise, get moving, because what happens is this burns off the stress chemicals and it helps tell the body that's in fight or flight emergency mode that we're getting away from the thing that's trying to eat us. It helps to alleviate anxiety, it helps to burn off stress chemicals. Definitely important to move. It's okay to take downtime. It's impossible to be on all the time. Make sure that you take some downtime for rest, for relaxation. Do that as best as you can in these trying times. And lastly, if you're experiencing the threat of domestic violence, first responders are there still to assist you, and shelters are still accepting people in need. If this is a problem, you can call the National Domestic Violence Hotline at 1-800-799-7233. Sometimes being alone, being isolated can cause depression, and many people, when they get depressed, have suicidal thoughts. If you're thinking of suicide, there is help. Please reach out to the National Suicide Prevention Lifeline at 1-800-273-4255. In my next video, we'll talk about pressing the reset button and a little bit about trauma. Until then, stay safe, take time for yourself, decompress as often as you can, and I'll talk to you soon.